Hey everyone, this is Doug with Maximum Wealth. Thanks for joining us today. We're continuing our discussion into Medicare, and we're joined by Mike Buckner here from Western and Southern Financial, and he is going to help us today understanding enrolling in Medicare and how we need to go about getting on the rolls of Medicare when we reach age 65. So Mike, I'll let you go ahead and take that away and help us to understand a little bit more in depth about what we need to do to get our names on these rolls.
Okay, enrolling in Medicare. This is very, very important. And like I prefaced and like Doug prefaced earlier, this is where you really need to work with an expert in this area, because you do not want to have any mistakes made when you're trying to enroll in Medicare. And there's different periods. And one of the periods is called your initial enrollment period, or what we call our IEP. You're going to hear a lot of acronyms here, but basically it's a 7-month period that begins 3 months before the month of your 61st or your 65th birthday and concludes 3 months after. So that's your IEP, or what we call your initial enrollment period. Okay. And then what we have is something else called your general enrollment period. Your general enrollment period starts January through March each year, with coverage beginning on July 1st. If you miss these periods, this general enrollment period, then you have what's called a late penalty. And why in the world would you get assessed a late penalty if you didn't enroll? Well, guess what? If you're not enrolling in Medicare, what are you not doing? You're not paying premiums.
Yep.
And so this is a way to go ahead and get you to pay your Part B premiums.
Yeah.
Because the government wants those Part B premiums to be able to fund Medicare. So they are going to assess you with that late penalty. So it's very, very important that you understand when you have to enroll in Medicare. And there's another enrollment period. It's called your SEP. Or SEP, your special enrollment period. So here we have another acronym, and this applies to those who are covered by an employer group plan, more than 20 employees. So here's what this is who this applies to. I work for a company called Western and Southern Financial. We have thousands of employees. I have healthcare coverage at Western and Southern Financial. I decide that, I'm going to work beyond age 65. I'm not going to retire. They did away with the retiree healthcare plan, which they can do if they want to. But whatever. But I would want to apply. However, if they did away with the plan, I would want to apply. However, if I'm sitting there and I'm working at the company and I'm still under the plan because I'm a worker with that company, I do not have to enroll in Medicare at age 65. Okay. Mm-hmm. Actually sign up for Part A and Part B at any time or within 8 months of leaving the group plan to avoid that late enrollment penalty. So if you are working, or even if your spouse is working and you're covered under their medical plan at work, their healthcare plan at work,
right,
do not have to enroll at age 65. You fall into what's called this special enrollment period. Okay. And that basically states that, hey, again, you can sign up for Part A and Part B within 8 months of leaving the plan to avoid that late enrollment penalty.
But let me interrupt you, Mike, if I can.
Yeah.
But you do have to be with an employer that has more than 20 employees. It can't.
More than 20 employees, right?
Okay.
So, small employers, this does not apply.
Yeah.
It applies for your larger employers, and as we know, the majority of businesses out there today are small employers,
Small business. Yep.
small
Absolutely.
businesses. And again, this is where I'm going to go back to start thinking about this, prior to getting close to age 65. You want to start thinking about this in your late 50s and your 60s, and when I should apply and how I'm going to adequately fund my premiums, the cost of insurance, the things of that nature. Okay, so if that isn't enough, you have other enrollment periods. Have what we call an open enrollment period. And I told you there's a lot of acronyms here. OEP is your open enrollment period. And like I said, here we are. We're getting very close to this. October 15th through December 7th every year, you get to enroll or change Medicare Part D plans, or enroll or change your Medicare Advantage plans. So you have that option October 15th through December 7th every year to make changes in your plans if you're not happy with what you currently have. Now, the Medicare Advantage, there's a disenrollment period, and this is your MADP, is February 1st through February 14th. I'm throwing a ton of dates out at you, and I know that, but like I keep saying, work with somebody that understands this,
Right.
because you do not want to miss these dates.
Well, they can always go back and hit the back arrow or what have you, and review these dates as well. And we'll put these two on the screen so that people that are doing the observing the video can see these dates again across the screen.
Yeah.
Mike, help me understand here the Medicare Advantage disenrollment period. What is that? Why would you have a disenrollment period? Is that to change the Medicare Advantage plan? Is that to drop it? What's that about right there?
Basically, it's to drop, to get out of them. It's to drop it.
Okay.
Basically, you're just January 1st through February 14th. They give you the ability to actually get out of that Medicare Advantage plan. It's more of a legality under these Medicare Advantage plans.
Gotcha.
So that's basically what that is. But why they make it so complicated, I don't know. But this is our government at work for us. It'd be easy if we just had one date where we could do everything, but it just doesn't work that way.
Sure. Okay.
All right. Other enrollment periods. We're not done yet, folks. We call a Medigap open enrollment period. And remember what I said Medigap was. That was something that you would purchase from a licensed insurance agent, licensed in healthcare. And these Medigap policies would go ahead and cover costs that is not covered under Part A, Part B, and Part D. These are, again, Medigap plans. This is not your Medicare Advantage plans. People get these confused all the time. They're totally different. Medicare Advantage plans, think of it like your healthcare plan at work or your HMO. A Medicare or a Medigap plan is just something that helps cover traditional Medicare costs that are not covered under the traditional Medicare plans.
That's like deductibles, that's like co-insurance, or anything else is left out as far as your that goes above and beyond the actual specifically covered items.
Yep. So basically, the enrollment period lasts 6 months, and starts the month you reach age 65 and are enrolled in Medicare Part B.
Okay.
So Medicare open enrollment period. There is, and this is important, no extra cost for those with pre-existing conditions if you enroll during this period. So it is very important if you have a pre-existing condition,
Yeah.
sure that you enroll during the period. If you do not enroll during that period, then you're going to get hit with extra cost. And here I go again. I feel like a broken record. Make sure you work with somebody that knows what they're doing in this area.
Absolutely.
Not just dabbles in it.
Yes, absolutely.
So, late penalties. Late penalties are going to definitely apply if you miss your enrollment period. And it's going to apply for as long as you're enrolled in Part B. Your monthly premium for Part B may go up 10% for each 12-month period that you had Part B, but you didn't sign up for it. So if I didn't sign up for Part B, I forgot. And I'm going to, my Part B premiums may go up 10% for each 12-month period that I could have been in Part B, but I didn't sign up for it. And the penalty clock's going to start ticking at the beginning of the month after the 7th month enrollment period. That's your IEP again, expires. And then it ends on the final day of the annual general enrollment period, your GEP. Here we go. In which you sign up for Part B, regardless of the actual date you signed up. That is a lot. Okay.
Boy, that's hard.
That really is not easy.
No.
And, again, this is where it gets very complicated, and you don't want to miss these dates. Right. And then a Medicare Part D penalty applies if there's a lapse in credible prescription drug coverage exceeding a 63-day period. Where they came up with 63 days and not just 60, I don't know. I don't write these laws. It's just the way it is. So, a nice little summary chart here that I have is, and I look at this, and this is kind of an easy way for me to kind of understand it, is you have your original Medicare, which is your Part A, that's our hospital coverage. Okay, you got your Part B, your medical coverage. That's like going to see your doctor.
Sure.
And then you have the option to have a prescription drug plan. That's your Part D. And then if that is not enough coverage for you, you go get that Medigap plan, and that can help cover your deductibles, copays, and other costs that Medicare doesn't pay. But you must have Medicare Part A and Part B to actually get that Medigap plan. Don't forget that. And again, these are offered by private companies. If you don't want Part A, Part B, or Part D, then you're going to opt for your Medicare Advantage plan. Mm-hmm. And that basically joins those Part A and Part Bs together. Most of these plans will also have drug coverage. They usually have lower deductibles and copays than Medicare. They may include additional benefits that Medicare doesn't provide, but you must have Medicare Part A and Part B to enroll. You still got to pay your Part B premiums, but these are offered by private companies. But again, remember what we talked about earlier. Make sure you know where these plans, your network and your service areas are for these types of plans. I can't emphasize that enough. Last thing you want to be is out of network, and then all of a sudden you're having to pay the full cost for health care. You can only imagine, you know what it costs to go into a hospital to see a doctor and have a surgery or whatever done. If you have to have emergency surgery, that can decimate somebody's retirement. So know your service areas and again, work with somebody that's very, very competent in that area.
Do your homework.
Do your homework.
Yeah.
Like I said, I'm not a doctor. I wouldn't perform surgery on myself. I may look at it, and I may Google a little bit, but I think people Google a little bit too much, and Google stuff is, and that's not an expert. Your expert is your doctor. Your expert in this area is someone that understands healthcare, understands all the nuances of the Medicare system and the Medicare Advantage plans, and experts in these areas. You can do some of your own research, but it's best to work with somebody, like I said, that knows what they're doing in this area.
What we've seen too, Mike, in working with some of our clients and people that have come to us that are actually not our clients, is that they will incur these costs in situations where they did not do their homework, or they did not understand what they were purchasing, did not get the coverage they thought they were purchasing with the plans that they bought. And they end up having to spend money in exorbitant ways that actually destroys a lot of times some of the legacies that they wanted to leave for families or family members. And they end up using all of their money over their lifetime. And we're talking about, 250 to 500, maybe thousand, maybe even $1 million that they go through because they did not have the proper advice given to them, or they did not have the proper products available and in place, when all they had to do was to have done a little homework in the beginning. And that goes back to our first video that we did as far as what the cost for healthcare is going to run. And what can we do? I mean, these careful steps that we're talking about, and I know you said it before, we sound like broken records here, but gosh, it's so important because the costs are so exorbitant and so large that you can end up just disinheriting your children or your family because you've had to spend all of your money on healthcare.
Right, and it could decimate your own retirement, and also think about if you happen to be married, and like I said, when we looked at longevity, husband and wife picked the wrong plan. Something happened. Husband has goes into the hospital, has to have surgery. He's picked the wrong Medicare Advantage plan. He's out of network. What happened? They spend the majority of their retirement money to pay for the medical bills, and now is that spouse left? So you need to think about all of those things when you're planning for healthcare and planning for things like Medicare.
100%.
Yep. So I like to take a break here, and I told you in the very beginning I want to talk a little bit about long-term care. This is not going to be a long discussion on long-term care. I just want to bring it up because I think it's a very important thing when we think about healthcare during our retirement years.
Absolutely. Absolutely. We look forward to that. Thank you, everyone, for joining. Again, subscribe to our channel. And I'm Doug with Maximum Wealth. Thanks for joining us today. And we'll be back with the next segment on long-term care. Thank you, Mike, for being with us today.
Thank you.